folks, the hour has come.
Okay.
So that at 2 o'clock, Jason, okay. I would like to call the Winnebago County Community Mental Health Board to convene this afternoon for its business on Wednesday, September 7th. And so I would really like to take roll call of our board. Richard Clinert, engineer, Dr. Bill Gorski.
Here.
Wendy Larson-Bennett.
Present.
Dr. Edward Copeland.
Here.
Dr. Terry Giardini.
Here.
Tim Neighbors. And Linda Strangler.
Here.
Okay. And so our director is Jason Holcomb from the Region 1 Planning Council. So we have no public comment today. Neither do we have any presentations this afternoon. So Jason, would you like to share with us the monthly activity report?
Sure, yes. We did attend the ACMI membership and business meetings in Bloomington. And we're able to get updated on a number of state issues. One of those in particular are the CESA task force that the state is putting together, which will help dictate the types of coordinations that are going to be needed between 911 systems, how the police, how law enforcement and programs like co-responders and mobile integrated health are going to function within the new regulations that go into effect January 1st. These regional task force are meant to be put in place to help those help implement strategies within local regions that are both compliant to the law but meet the needs of communities. So we received indication from the state of Illinois through the president of ACMI that they would be putting mental health board representatives on each of the regional task force. And that was something that ACMI directly advocated for that they would do. So we'll certainly keep you updated. I did apply for our region's task force to be part of that. And we will see who ends up being appointed to that.
Jason, give us CESA, what is that?
So CESA is the, I believe, Community Emergency Services. And I'm not probably saying it correct, but it's essentially the law that was put into place, really meant to be a disability parity act to state that if it is a mental health call going to 911, that unless there is physical presence of danger in the scene, that there should not be a law enforcement dispatch. There has to be an alternative method of dispatch. It's not to be confused with 988, but those are two separate things happening at the same time. And so while other states are just dealing with how to integrate 988, in Illinois, we have two different things happening at the same time. So we not only have to, integrate 988, but then also understand how 988 integrates with the implications of CESA. So we have in the state of Illinois a little bit of a unique situation in that with two things kind of coming online at the same time that have to be really sorted out. The task force, the regional task force will mainly be focused on CESA, but I can only imagine they will have to also be talking about 988, 911 integrations and coordinations, because that's going to be a huge component of how you have alternative response to crisis. That was really the big thing. We're continuing to finalize contracts with funded agencies. I'll give you an update on one of those today. I think we have only one outstanding, and everything else I believe has been finalized.
Okay, and thank you. So then, folks, let's move, let the record incidentally show that Tim Neighbors is present for our meeting today. Welcome, Timothy. Okay. All right. So action items. First of all would be to approve the minutes for our last meeting, our last August meeting.
So move.
Okay. We have a motion and seconded for All in favor of accepting the minutes for the last August meeting?
Aye.
Okay, anyone disapproving? Okay, hearing none, it passed. The second one is our action is this resolution number 2022X, the resolution authorizing funded program budget updates for program year 22 to 23. Jason, do you want to fill us in on this before we
Yeah,
take our
so
vote?
there's Remedies Renewing Lives had two different funded programs, and both of them required budget amendments that were directives of the mental health board when we reviewed the applications and came up with the special conditions and funding agreements. So these were simply follow-ups to what the mental health board directed, and they were essentially updated their budgets as they were asked to do. So those are simply formality of what was asked, and then Stepping Stones had already entered their funding agreement and work plan and is now asking for a during program year amendment, and we have Candy O'Brien from Stepping Stones who can briefly present to the board. She's on Zoom, the request that they are making. Candy?
Okay, I just have a few items. We have adjusted line 19 for our receptionist staff salaries based on the past couple of months. We have both positions filled now based on averages. It was slightly elevated. So in doing that, I would like to add office furniture, which is on line 13. Let me really quick. Of $3,136 on line 13 for office furniture, which should bring us flush with that building from last year. And I want to add occupancy line 19 of $35,000, which is the final installment of the remodel that took place at our building. And then also under line 19, which would be receptionist salaries and benefits. That's where I decreased substantially to bring it more in line with the average salaries for the past 2 months. And then added line 20 times 3, general repairs and maintenance for $3,500, general housekeeping for $1,500, and classified ads, postage, shipping tied to that of $4,700. We're spending a lot of money looking for staff to get fully staffed. There's no change in number of persons served with these budget amendment changes.
Thank you.
Mm-hmm.
All right, and I neglected incidentally to introduce guests in terms of Chelsea Glantz, God Lover, who takes care of all of our minutes, and Brandy Quantz. Thank you for being present this afternoon from give us legal support. Okay, so folks, on this resolution, because it involves money, there'll be a roll call. So yes, Timothy.
All these resolutions, there are a lot of increases. Do they increase the total budget, or will it wash out with changing different line items?
No change in the overall original approved budget total, just in the line items themselves.
And I confirm that's our understanding as well.
Okay.
A couple of questions.
Bill.
So in the remedies, in both of them, Jason, you show for both adjustments increases on the revenue side. Is that billings?
That was intentional. So the issues that existed with the remedies projects as we saw them was that they, on their behavioral health program, had not included Medicaid billed revenue. And so in conversations with them, they understood that the services they're providing would, some of them be reimbursable through Medicaid, and that they needed to include that revenue generation. So that was our recommendation to them, and that's what they ended up doing. on the domestic violence therapy and advocacy project, that we are giving them matching funds on an ICEJA grant, and they simply failed to include the ICEJA revenue on their original budget. So that's where that ended up being added as revenue so that's a 75-25 match that we do for them to maintain their ICEJA funding for that program.
But to Tim's point, that's all.
Those
same.
all net out
All net
to
out.
be the same. The expense numbers do not go up.
Okay. The only question on the stepping stones side project, it says in the narrative, revenue was also increased to match the updated total revenue estimate. On the revenue changes at the bottom, it says no change. Is that, maybe I'm missing something there.
I'm sorry, which program was that?
Stepping stones.
Oh, on stepping stones.
It says revenue was also increased to match the updated total revenue estimate, but then the revenue changes at the bottom, it says no change.
I did not change any revenue from my perspective.
Line are you, or is that just?
Revenues, the stepping stones.
That's
It's
Alright.
right up there. It says, I can read it from here. You can read distance, okay.
That's
Okay.
good, you're better
But
than
in the
me.
narrative,
I
it
got it.
says revenue was also increased to match the updated total revenue estimates, the last line of the paragraph.
Candy, are you able to confirm that there's no additional revenue being added to the budget?
Right, I did not add any additional revenue to the budget. These changes wouldn't create an increase or decrease in revenue.
I believe that's a clerical error, and I
Okay.
would suggest that we take that out. And
That sentence about the revenue being increased.
yes.
Okay.
Yeah.
Any other questions? Okay. So hearing none. All those in favor of,
Do we have a motion on this?
we need a motion, pardon me. Edward, do you want, okay. So, all right.
Do we want to clarify the motion would be to approve the resolution with the sentence, revenue was also increased to match the updated total revenue estimate removed from stepping stones portion?
Yeah, what you said.
So moved.
Okay, all right, so need a resolution.
You make a motion, I'll
You're
second.
getting one. Terry, so, and we have a second. So those in favor of,
Roll call.
I'll behave. All right, for the resolution authorizing funded program budget updates. Those in favor, Mary Ann Abadi, who's not here this afternoon, Dr. Copeland,
Aye.
Terry Giordani,
Sure, yes.
okay, Dr. Gorski,
Aye.
okay, Wendy Larson Bennett,
Aye.
Tim Neighbors,
Aye.
Linda Stradquist,
Yes.
and Dick Kunert, yes. Okay. No, all right, so then moving on in our agenda, discussion items. First of all, there's an issue of the MIH program update. Jason, are you going to lead into that?
Yeah, so as I had mentioned earlier, there's one outstanding work plan that we're still working on, and that is for the mobile integrated health behavioral health expansion program. We're mostly okay with everything. It's just the hours of operation that we're still trying to, I guess, reach agreement on or understand to ensure that what we're funding allows for the maximum hours of coverage as possible. And so what the funded program has offered that they think would be best, would be a good learning moment for the mental health board would be to do a tour of the 911 facility, and then to have a special board meeting that would take place in their facility where they could give us a presentation, and we could have access to their staff that operates that program to ask our questions and have them answered, so that we can come to a place of complete comfort with the hours of operation and maybe understand the vision of what it is currently and what it intends to be over time. So I put that up just as more of an update. I don't have specific dates yet, but I would likely, if the board finds that agreeable, that I would send out some dates and options for everyone. That would be an open board meeting, a special open board meeting, and they understand that and are okay with that, knowing that members of the public may attend.
I think
So
that's
what-
an excellent idea.
So what we done in the past with the, I'm sorry, for like the county board, so to avoid having an open meeting, we would just have a day where we could take tours at certain times, and they will answer our individual questions as we take tours, and then come back and do invite them to a meeting or presentation at our next time. So that way, everybody don't have to come up with the same time. Everybody could go up with it and take a tour with the 911 supervisor at their own time, and then we can come back.
And then have them come to our meeting.
Right.
I don't think that's a bad idea.
So to that, well, that would mean that no more than two of us could be there at the same time. Is that
Right.
correct? For the tour.
Right.
Okay.
Mhm.
I guess I really don't have a problem with us collectively going and having a conversation. I think this board is aimed at being transparent in what we do and giving the community an opportunity to see what happens at the 911 center might be an excellent.
I don't think it'll be a good idea to have an open meeting at the 911 center
Okay.
where a whole bunch of people could come in and probably interrupt the flow of 911 calls.
Got it. Okay. Good point. Point taken.
We take,
I guess one of the questions I'd like to see addressed, as long as we're talking about the CESA grant and the change in the law, is how what we are doing in our fiscal year is going to be integrated into the upcoming law changes. So, in other words, we're funding our vision, of community service, but now overlaying on top of that is a new legal mandate for the 911 center, both city and county. How, so if we're talking about, if the law talks about 24-hour coverage, we're funding part of it. What is their intention? That may change what they're doing and what we're doing and how we're integrating. So I think these are reasonable questions to be thinking about, talking about.
Yeah. It's gonna get very complicated.
Yeah.
Well, what I hope we are the
Lead people.
grease, making it not complicated, we thought about this in advance in a certain way. And the proposal seems to answer some of our issues. So let's continue to lead in this area.
Like that.
Okay, I will ask them what other alternative options exist, such as a tour day, and communicate that back.
Okay, great. Okay, our second discussion item is the 3-year strategic plan update.
Yeah, so in conversations with board members over the last several weeks, I know that people have had ideas about additional things that we might want to do. I just wanted to give everyone kind of the reminder or notice that this is the year that we have to update our 3-year strategic plan. So there will be an opportunity for board members to participate in that planning process and to really shape, that first plan shaped our first 3 years of funding. This next plan is going to shape our next 3 years of funding. And so we anticipate that we will have a work plan in October that we can present to the board for what we believe the methodology and process for the strategic planning will look like. And so I guess be prepared at that time if you want to to talk about that and to formalize what our 3-year strategic plan update will be. But I just wanted to put that on everyone's radar that that's coming up, and that's a big moment for us, right? Those 3-year cycles really, that starts with that planning process. We have already, so I'll embarrass somebody, Ariel has joined my team. She was a highly recommended intern from Community Foundation of Northern Illinois, and showed a strong interest in mental health. Their youth in Youth We Trust program now is focused on mental health for this current funding cycle. And so she has come on to take the opportunity to really engage in this planning process and in conjunction with Chelsea and I to try to lead that effort with us. And so she's been really working at updating our environmental scan survey. And so that's the other thing that we will present at the next board meeting, is that updated environmental scan survey, so that we can also use that both as a planning tool this time, but this time around doing it for the second time, it kind of becomes an evaluation tool as well, because we get to see how those results compare to where they did a couple of years ago when we did it for the first time.
Welcome. So Jason, would you be looking to schedule, could we have like one-on-ones with you all, or like individual meetings leading up to understand better, or do you anticipate that or not? Or we have an opportunity for input?
Into the process or the plan itself?
Probably the plan itself.
Yeah, next week, we just want to show the outline of a planning process and where those input moments will be from board members.
Okay.
We'll have to logistically figure out with Open Meetings Act how we could do it, but we've thought that this time around, since we have more time to do it, there's less urgency, that we could have maybe a like half-day special planning meeting with the board members. Of course, it would be open to the public, but that would be fine, right? And so that there'd be maybe an opportunity to do something like that.
Okay.
If board members felt like they were available to take like, a few hours or half a day to engage in a facilitated planning process.
And when is the date you're shooting for approval? When would that be?
Probably targeting no later than September of 2023, because we want to have that set up for that next funding cycle.
Okay.
In that time range, so we could potentially have a year. Like we could do a lot more things than we did last time when we did a planning process in 3 months. Is what I'm suggesting. Could do more community engagement, more board engagement.
Great. Thank you.
Okay. All right. Other matters needed for discussion. Jim.
I got two. One is the issue with one of the applications that got rejected by the county. The county board really wants to know if the mental health board has an appeal process. And we don't have an appeal process, and they know we don't have an appeal process and want to know if we are interested in developing one. And I want to present to the board, the idea of developing one, or if it's not a good idea, have some points on why it's not a good idea, so I can present that to the county board. The other one is, lost my train of thought. I should have wrote it down.
You want to talk about the mental health application that the county board received?
I don't know if anybody have any questions or want to talk about it,
Okay.
but I just,
All right.
Well, can we talk about that idea of
The
the
first one.
appeal process? The main stumbling block is we have a budget that we're operating within, right? And we make grants based on available resources, right? So if we have an appeal process, that essentially stops all funding for approved projects, because granting another project would upset our planning process. So while I understand the thought behind it, I think we laid out criteria and how the board is doing its application process, and there are lots of resources available in Jason's staff for interested parties. So if they want to understand how we're rating projects or ranking them, the information is there. That's my main thought about an appeal process, is then it holds everything up.
So is there any other thing in the county where there is an appeal process for grant making?
Good question.
So if I could weigh in here, typically the appeal process doesn't arise. It's basically due process. So once somebody is deprived of life, liberty, or a property interest, that is when a government body is required to give them due process. So our situation, we do have an appeals process, I believe, in our funding agreement, but it is after already the grant has been awarded, and then somebody has an interest in that money. So they've got the contract interest, so they have the property interest in the money. So when you're talking about an appeal process for an application, it wouldn't legally be required. And I agree, it would be difficult because it would hold, like, how are they going to appeal? If you award all of the money at one time, then there's an appeal. Whose money are you taking away in case they win their appeal? You are kind of stymied. You can't move forward at that point. It would have to be, you're going to have to start your funding cycle at an earlier date. And you're going to run into when you actually know how much money you have and how long the application process is going to be, because now you're going to have to account for an appeal process. So you're going to be tentatively awarding grants, then an appeal, and then going back and determining whether or not you need to change the amounts that were tentatively awarded. So I think from a legal standpoint, they do not have a right to an appeal yet when they're applying for something. You still have to follow the law, obviously, but they don't have that due process right at that point.
I guess my point is that aside from what Wendy's already said, which I think is, and what you just reiterated, which I think is the point, our funding cycles are just within a year. It's not like it's a 2-year wait or 3-year wait. You can just apply the next year. But my whole point is I've never even heard of a legal theory that would justify an appeal. And that's why I was asking, is there something I've missed? Maybe I've been on another planet, but I've never even heard of an application. I've never even seen it, never even heard of anything like that. And for them to bring it up, I'm just asking, are they doing it in some other area? Because maybe there's a template that gets around all these legal doctrines that you just enumerated, that Wendy has just said, and that I'm aware of, and I know of none.
Well, I'm not speaking about from the technical perspective, because Brandy's made that very clear. I'm thinking more of the public perception of, as a public board, how do we create not only the perception but the reality that we are open to feedback to some degree. So I guess I have 2 questions, and if I don't say them both, I'll forget one of them for sure. One of them is, Brandy, are you aware, despite the technical aspects of appeal for public bodies, you made that clear, are there any mental health boards anywhere that have one anyway, that they have some sort of appeal process? And I'm not advocating for it, I need to learn more. My second question is, in the process of application, Jason, this is for you. I'm assuming that without judgment, there's some feedback back to the applicant about something about their application that is either incorrect or incomplete, or all the lines aren't, I mean, there is communication right during the process about your application if it isn't meeting the full requirements of the application. Is that correct?
We provide a summary document to each agency that shows basically a summary of the board member comments, not verbatim, but a summarization of what the feedback was, and then it gives them their score. And then there's a decision rationale at the end that might kind of try to basically get to the gist of why it wasn't awarded.
Well, my question is more, even before the time of judgment by the board, even leading up to that,
Mhm.
is you, Chelsea, your staff somehow interacting with them regarding the nature of the application, if portions of it are inappropriately filled out or incomplete. So even before it reaches us, have they gotten any feedback from you or not? It's kind of like submitted and.
Only if there were a technical issue, so
Okay.
not a programmatic issue. If there was something that was missing, we might say, can you provide this? But
Okay,
it would just be to make the application complete, not to give programmatic advice. But we do offer technical assistance throughout the grant application period, in addition to a grant seekers meeting and question and answer sessions, so that grantees can come in and they can ask. We're not shaping their program for them, but maybe giving them the context about the meaning of the things in the strategic plan, in addition to the kind of technical issues, that contextual component as well.
well, I think that's important that you do that. And then it would be safe to say that when it reaches us, none of them are rejected on technical issues. By that point, they would have been advised about that.
Correct.
Okay.
So what we're doing basically is ranking them based individually on our assessment of how each program stacks up, and then whatever our collective ranking is how the score is assembled.
Right.
That's right.
So Brandy, the first question, does anybody do this out there that you're aware of?
Not that I'm aware of, not during the application stage, no. Due process, I mean, that's essentially what it is only done after some is taken. So for instance, once you get a traffic ticket, then court is due process. That's giving someone the opportunity to be heard and to present their side of the story. But again, it's only after they've been awarded. Or so, like, for instance, we represent the McHenry County Mental Health Board. They also have in their funding agreements an appeal process after it's been funded, but not.
So my other question would be, so is there a way that, other than technical, that they could get feedback to adjust the programming to increase their ability to get funded before it's rejected?
We haven't currently been doing that as outside of the grant cycle itself, right? I mean, we do give the feedback, but then it's up to the program if they apply the next year. Something I'd like to suggest, I think this is important for this conversation right now, is that we can't assume that our grant notice of funding opportunity process will look the same every year, because we'll never be in the situation we were in the first 2 years. We are now looking at a much larger percentage of our budget being in renewal area, assuming that we continue to renew successful programs. We're not going to ever have $9 million of unallocated funds again, likely, unless there's sales tax changes that are completely unpredictable to us. So in thinking about how we fund in the future, I mean, the other question is, like, do we get to a point where we're focused more strategically on the remaining gaps, and our notice of funding itself is more specific in what the type of request we want to receive?
I think that's a key point, because compared to, say, other grant-making organizations, it seems to me we've done a lot of hard work as it relates to figuring out the types of things that need to be funded in order for this continuum of care to be robust and complete. So it's not just, do you have a good idea? It's, there's a gap in the community, and we don't necessarily control all of that. But
This is our standard.
right, and that's,
This is our standard, 11 services that are based again on good practice, what it takes to keep serious mentally ill and serious emotionally disturbed kids in the community. And even among these 11, we obviously ranked them differently because of again, of their importance in terms of managing crisis, for example, is a big one that we're working on right now. And the other one that we put a lot of emphasis in the first couple of years is providing treatment. So some of the others that we know have value, but they're not at a place for as an example, peer support being one of them. Where does that fit vis-a-vis, again, where we are with our priorities of core services necessary to keep people out of the hospital, out of the jail, and out of the emergency room. So,
Well,
I'm sorry.
some of that goes, some of what Dick is talking about, I think, goes to the board doing some, I think, deep thinking about what is next. So we do have X millions of dollars already committed, assuming programs are making appropriate progress towards fulfilling what our hopes are for them. So now we already see areas that we've not provided for, gaps that we haven't addressed, an idea that, has been thrown around is transportation. How do we help people? Now we have services. How do people get there? Those sorts of things. How does this board creatively fund those gaps, and how do we, rather than just having an open invitation, please apply, how do we target? We don't have a child psychiatrist in Winnebago County. How are we going to get there? Who are we going to ask? How are we going to achieve this vision that I think the community gave to us when they filled out our assessment? We need a child psychiatrist. How are we going to get it? I think that's our job to figure out. And if people are unhappy with our decisions, I guess I would hope they would come to us in the form of public comment and tell us, we think, this is what you should have done and this is why, so that we can understand what our community is saying to us,
Or is that said, come back next year?
or come back next year, talk to our staff.
but that's my point. It's not like you gotta wait, an interminable amount of time. But I think Dick's point is the point for me, and that is we have a very clear vision and it's articulated. It's not hidden, that these are the things, these are the priorities, and this is how we came up with it. We didn't come up with it. This isn't, what's the movie? This isn't Hamilton, you wasn't in the room or whatever.
Yeah, all right.
The room where it happens.
Yeah,
Everybody was in the room.
Right.
It's not a secret society type of thing. It's wide open and it's very clearly articulated. And I think that an appeal process, in light of all the other things, it doesn't fit this animal, because all of the things that due process tries to accommodate has already been taken care of. It's already been baked into the whole system.
That's right.
One more
I-
question. Go ahead.
Don't forget your question though. Sorry. I think that's actually a problem that a lot of boards have, because who from the public is at your meeting today? Anyone? You have one of your grantees there, but that's it. So I think a lot of boards just have that issue. They really do everything out in the open, and they have materials and they have what are the qualifications for this grant and what is the vision for the mental health board? You have those long-term documents, but people don't, people think, oh, funding opportunity, I'm going to apply. They don't attend the meetings. They don't necessarily know the other people that are applying or where they're ranking within that system. So I think in general, that is a problem that boards have. I don't know what the answer to that is, maybe more public outreach, but it's also the duty of the public then, if they want to be involved, to actually get involved.
So my question, what is the gap in suicide crisis response? So here in Winnebago County, is there a gap, and how many organizations do we have that can respond rather quickly? Because I know with the issue with the county board, with the applicant, that particular issue with the marshmallow program, they say there is no quick response and they will be the quickest response.
But that's not really accurate for us, because we have the co-responder program that we're paying for. That's one of the reasons, and we're talking about expanding that with the MIH program, with the combination between the fire department and Swedish American Hospital's behavioral health. So, I mean, if anything, we have put into place at least the parts to create as comprehensive a community response team that you could get. That's where our dream is, and that's what we're in the process of working out. So that there aren't that, and to have, for example, to back that up is the crisis center in Mulberry in terms of 24 hours, 7. That's who they catch in a sense, So again, from a community point of view, I see us doing far more than almost what any downstate county is capable of doing. Okay, and so yeah, that's really we're at the edge of that, and we don't and so would we like to save everybody? And the answer is yes, but at the same time, I think we're using all the tools that are known these days that the public can introduce in a community to try to keep it as healthy as possible.
And remember, we're funding a number of organizations that have increased their staffing so that families and kids don't have to wait months and months for services. Stepping Stones is expanding their outpatient treatment. There are a number of programs that are working on these issues. Is it perfect yet? Are we still missing things? Yes, this is a work in progress. If you listen to television, just in the last week, there have been programs about pediatricians integrating mental health resources into their own offices because families are having such a difficult time accessing professional resources for their suicidal children. And I don't think that peer support without adequate training is an answer. I think the answer is working harder to get resources into our community at an access point that families find it easy to obtain.
But if I could, Tim, even his position needs to understand and be able to articulate the decision about an appeals process. And if I can just clarify what I think I heard you say, Jason. So leading up to decision, the applicant will get technical advice if the application is deficient in some fashion or form. The second thing you said is if the application falls out of the community support system or is not consistent with our strategic plan, you may give them some feedback. Well, this doesn't really fit. Did I hear you say that correctly? This doesn't fit quite into the strategic plan. So I heard that correctly.
Yes.
Then again, post-award, not awarded, you give them the feedback blinded to some degree of what the issues were that resulted in the non-award decision.
Correct.
and then they can apply next year. I mean, that's basically,
And I can
that's kind of the
say
summary.
that for the application in question, all of those things that you mentioned were provided.
What I don't want to see is organizations who, for whatever reasons, don't get all the funding or any of the funding they were seeking, then using the dad said no, so let's go see what mom says method of obtaining what they want. Any family who's raised a child knows that that sets you up for failure, not success. If dad says no, mom needs to say, Dad, why did you say no? And listen. And then we can have a discussion like adults instead of playing games. That's my thought.
I remember my other question now. So my other, right, so my other question was, are we in contact with our people for mental health? Or do we have a foundation for mental health? So we could start planning our campaign for when it's time to renew in a couple years for the mental health.
We have
Because
to decide.
That's an interesting, kind of comment. That's a discussion point that Mary Ann and I and Jason have been talking about. And we're talking about bringing up that next month to have a communication plan. Okay, how do we give feedback about what we're doing to the community in an organized way? So that again, far more people than currently know about the various changes that we have made within the community. So that's going to take probably, again, multiple kind of potential providers coming in and to present plans to us that we in turn, respond to with a bid to hire somebody to help us do that.
right, and well, since we will have to have, my question was, we will have to have a separate foundation because we can't use mental health funds, the tax funds for a campaign. So we have to campaign and get other people to contribute to a foundation or people for mental health projects so we can start campaigning.
Well, that certainly is how the tax revenue got passed.
So I know that's how I got passed, but I just don't want them to think since it's there, we still have to campaign again, so.
Yeah.
So I just want to be
That's
in
important
conversation.
for us to remember.
Yeah.
That's exactly right. That's exactly right. So, yeah, that's interesting. Okay. So Brandy, that's a good question of kind of like, so as this mental health board, what is our prerogatives in terms of spending some of our funds to communicate our work to the community?
Well, I think you would have to, I would have to look at the statute and the wording of your referendum. There's certainly some aspect of that you can do. I would say part of it though is also on the programs that are funded as well. The foundation is a completely different thing. Are you talking about like having people donate gifts for raising mental health?
No, it's for the actual campaign vote. Now, you can advertise as far as anything for mental health, but when it's time to come for a vote, the actual campaign cost to campaign for the mental health tax.
Yeah.
We can't spend that.
I see what you're saying. Correct. Like you can't use it for political purposes. No.
Right. And so this is a political organization. We have to start planning that part of this, of this organization too. Right.
I thought you meant like a mental health marketing campaign is what I thought. Yes, you are absolutely correct. You can't spend those funds for political means.
we can, there are a number of people who were involved in
Right, I
that.
mean,
that we
just-
could-
Like, for example, just like the Park District have the Park District Foundation, but they keep it separate from the actual operation from some project. So I think the mental health board needs a mental health foundation or something like that.
That's a good idea.
So, for people for mental health.
Randy, you mentioned the funded organizations and projects. Is there any sort of slippery slope there? And Jason and I have talked about this with almost setting an expectation that a funded organization with their own departments promotes what they're now able to do because of the funding that the mental health board has gotten to them, so that it becomes kind of a drip, drip, drip out there in the community as we're able to do more. The organizations themselves are saying, hey, if it wasn't for the funding from the mental health board, we wouldn't be able to do A, B, and C. Is that okay or not?
Yeah, that's okay. Actually, I just looked at one of the grants for ARPA funds yesterday, and it actually requires the city that received the grant to run any communications past the state of Illinois. And it's essentially the provision that says you can't go out and say all these good things that you are doing without giving credit to the department, the DCEO, basically. So I think that, I mean, you may want to control some of that, what they are saying and how they're saying it, but that's a great way to raise awareness of this is the good stuff that the mental health board is doing. And these are the services that we can now provide to Winnebago County because of the sales tax and what the mental health board is doing. And that's what you're trying to do anyway. You're trying to raise awareness for mental health and to get services to the people that they need. And I think that's a good way.
Exactly.
So theoretically, could we create a coalition then of grantees who collectively hire a marketing firm to give communication to the communities within this county as to what's going on programmatically?
We could do that.
Yeah, you mean for marketing? Sure.
Sure. Okay.
I thought we.
Yeah, and that's gonna fall under.
That's why I
Yeah,
see.
we're intending to do that. We already discussed that with the funded organizations at the last learning network. And we asked for organizations that had dedicated marketing and communications people to volunteer for that, to participate. So not all of the agencies are built the same. In some agencies where you're a small nonprofit, all your staff is clinical, and you've got maybe the best writer in your organization's writing your posts, right? And somebody else that just knows how to use InDesign is doing some of your stuff, right? So it's kind of, but there are agencies that have dedicated marketing communications departments. And so we've asked them to, understanding the importance of this work and the community support system model, that layer outside of the wrapping around everything is mental health promotion and awareness.
Right.
And so on a volunteer basis, we've asked them to participate in a communications work group where those that have a little bit more can help those that don't have as much with developing toolkits and coordinated efforts of how to get the word out about all the funded programs, not as a campaign, but as an awareness and promotion of how the half-cent sales tax is impacting the funded programs that are currently developed. And so that's a starting point, at least, of where we're at, just to let you know, that's already kind of in place.
Well, and also I would hope that when, case in point, families of children who are having mental health crises are floundering around, they have heard of various organizations that they might reach out to get assistance, so that we're doing, I think they're already doing some of this in terms of better coordination amongst our funded programs so that they're independently aware of what the other programs are doing, so that then they have a client who comes in and says X, We don't do that, but let me put you in touch with.
Yeah, so there are three types of working groups, or two types of working groups we want to do. One was the communications working groups. We have the funded networks that
Right.
but it's a lot of people all at once, right? And it's different types of people. It's program directors, executive directors. It's not always frontline staff. Sometimes it's administrators. We also were thinking about doing like an ad hoc work group within that network for case managers or the people that do the referrals, the navigators type
Yes.
thing. But I know that MCNE already has a case manager community of practice type thing. So I do want to see what their current efforts are as to not duplicate. I mean, if there's a partnership opportunity, I'm not suggesting funding, but just a partnership of what's already existing. I think that might be worth exploring before we start something, but I think you're right. Those are different things, right? There's your frontline staff knowing your referrals, who to refer people to, and then you have your promotion and awareness to the general public about what is being funded, what programs are available, how you access them. And that's two different strategies that we are trying to address.
So this is my dilemma. So we work with mental health organizations and people that deal with mental health, so we always hear the accolades. There are a ton of voters that don't deal with people with mental health that still have the opportunity to vote. And then they don't want to pay no more taxes. So my thing is, how do we appeal to them? Because we depend on their vote just as well as the people that deal
The
with mental
truth
health.
of the matter is, I mean, I worked on the sales tax referendum. I was out talking to community groups all over Winnebago County. People see the gaps and understand the need. And I think if we're going to make this political, the politics is someone in your family needs help. And the only way they're going to get it is if we as a community lock arms and start applying our individual resources to make sure that everyone in the community has access. And we had a mandate, a voter mandate, to fund mental health and addiction services in Winnebago County. And I think this board is doing an excellent job of going from nothing 2 years ago, in the middle of the pandemic. Remember when this referendum passed, the spring of 2020, as the United States and the world were shutting down. We developed a work plan, a methodology, a set of priorities. We funded those priorities. We are in our second year. We are still crawling, but we're starting to stand up. And that's the message to our community. And maybe we do need to bring our providers together to tout that message. You know, law enforcement, you know, one of the things they're seeing, I am sure, is a change in who the clientele is in the Winnebago County Jail. I think people are getting more resources, more appropriate resources, better evaluation. It's gonna,
Yeah,
and over
and
time,
accessible.
yeah, and
So-
over time, it's gonna change this
Yeah.
county. It's not gonna be tomorrow, but it is gonna change.
And the other part of that is, again, I guess what I'm kind of reacting to Tim, is I don't want it political. I don't want it to be politicized. I see it, I see our education.
It's inevitable because we
I
are a
know, I
political
know.
organization, so
I
it
know.
has to be politicized.
I understand that. I understand that, but at the same time, what we're trying to do is break down stigma. And we're trying to say that we're a legitimate part of the healthcare system within this community and that we're doing something about that. And that's the information that we want people to have. So the fact that we're using county money or, you know, sales tax money to do that, okay, but that's not Democrat or Republican or anything else. That's just kind of like what we're responding to is what we received in terms of 60-some% of the people saying, we have a human need. And we need to give information about what we're doing. I mean, just another example of one thing that was just mentioned this afternoon. There are not a lot of healthcare systems like Crusader, for example, that have integrated the mental health person into the doctor's office in the same way that they have. People ought to know about that. You know, again, again, we have programs that are taking us to the edge of the art of like how we can best help people.
I totally
I know,
understand where everybody, and I totally agree.
I know, I'm speaking
But
to the choir.
If people would like members of the mental health board to speak to political organizations about the benefits of the mental health sales tax, please reach out. I think any one of us would be well able to discuss why this shouldn't be a political issue and why trying to shoehorn in programs that the board has said not this year for without talking to us about the why is a problem, you know?
Go ahead. Linda.
Thank you.
Linda's first.
Yeah, I want to point this out as a funder. So having worked for the Community Foundation and also for United Way, when we funded agencies, we made it mandatory that they said this program is funded by, and in this case, that's one of the things we should be doing, you know, on all of their program materials, on their website. I think once upon a time, United Way had clings that you put in the window that said you were a partner agency. And I think we absolutely can borrow that from those other funders. And as I said, you make it part of the grant agreement and they sign off on it and then they have to do that. So then somebody gets a brochure from someone and it says right on there, funded by the Winnebago County Community Mental Health Board.
Yes.
Tim isn't looking happy, but
Well, but Tim's point, if I could, it is political, even if we don't. And I would predict this, it could be, what was 60-some-odd% the first go around?
Yeah.
Let's not just hope for that.
Right.
second go around, Because the second go around is gonna be, what have you done?
right.
And I think this whole conversation is, I think that's a great point. And again, this idea with Jason, I'm so happy you started that already. But if it can be made a requirement that we receive some sort of recognition of it, so that begins to percolate through the community. Because your point, Tim, is it won't be as easy the second time.
Yeah,
I
I
would
agree.
think.
Well, we can
Because
It
require.
wasn't easy.
Well,
I
with
know
that-
that,
with
I
that
have to excuse
plurality.
myself from the meeting. I'd
Can I-
rather get
Yeah.
across the
Can
county.
I tell you the other reason why?
Yeah,
The people that want this, the issue that we have to deal with this week with this fund do not want the mental health tax.
I agree.
And they've already started campaigning and planning and starting their process to get rid of the tax. So if we don't plan politically, we will lose this tax.
Okay.
Because they've already started.
That's the bottom line.
That's about,
Well, let's,
thank you for that.
thank you.
And so, and just saying, you know, we're going through this tonight, this week with this. It's a political tool that they're using.
Okay.
So it's not just about the funding process. It's a political tool that they're using.
Well, then we need to call it out for what it is.
Well, that's a whole other.
Yeah.
How that becomes a little
Until
dicey.
they stab in the back all the organizations that we help fund.
Okay,
I mean, I understand, Tim, you're right.
okay.
They stab programs in the back.
All right.
All right. So I would entertain a motion for adjournment.
Not yet. No, let's end on a little bit brighter note here if we can. You can tell Halloween is coming because Walmart has their Christmas decorations out. And Ed, I know we had talked before about doing something again with last year we had you do that.
Yeah,
with
the
your-
holiday
Get
thing.
some people out there and we can all have something to say. You with your ecumenical component, you being a mortician and understanding people, and we all bring something to the table. I think we should do something again come November 1st, so we can do something in the month of October where your folks can do these little snippets where we're talking about, maybe being a volunteer, you want, helping, humor, volunteering, faith, things like that to alleviate some of it. We can do a little 15-second snippet that we can put on our website. We can ask those people who we provide for to put it on their websites and what have you, so they can see it. Just it's also a good PR move on our part.
Yes.
As you know,
You're in
obviously,
charge, Chair.
I will be happy to be in charge of that, absolutely.
Run with it.
Right.
Yes.
I love
I just think it's probably one of, a thing that last year, I know we did that with, and it was you and Danielle. I thought it went pretty well. And if we could do that again, I think that's with each and every one of us having something to say. Whatever it is that you want to talk about, tell me. And I will sit down with Jason and Chelsea Weber and Ariel's after that case and come up with some little 15-second snippets.
Great idea.
That's great.
Okay, now you can meet them. Oh,
I so move.
Second.
All in favor?
aye.